Thank you for joining again. So this is part 2 of the research question. Just a little bit of recap. The research question is the starting point for any research. It's the head of the anatomy of research. And logically, it leads to the research objective. And research questions, they don't start, as specific questions. They usually start as a general concern, and then it's up to the researcher to narrow them down to a concrete answerable question. An example is, say we have, the COVID-19 vaccine as a general concern, and anyone can have that concern. Any part of the public can, ask questions about the COVID-19 vaccines. But when you come to the research question, it has to be very concrete and specific. So some examples of these questions include, what is the protective effect of various COVID-19 vaccines, for example? Do the vaccines reduce disease severity? What are the common side effects? So these are researchable questions that should be answered through a systematic process, which is called research. A good litmus test for any research is to ask the question, so what? You can ask any question, but you should also be able to answer the question, so what? What do you achieve by answering this question? So this should be something useful to society. This should be something that can advance the understanding of a certain aspect of a disease or a problem. So it's very important to ask the so what question, even if you think the question that you're asking is interesting. So it's not just for curiosity that we do research. It should answer the so what part of the question as well. Okay, so what are the criteria for a good research question? We have developed a simplified acronym called REFINE to summarize the criteria for a good research question. So this acronym is key for identifying a good research question. And the REFINE stands for relevance, ethics, feasibility, interest, novelty, and equity of research questions. For those of you who are familiar with the FINER criteria, which is a famous criteria that has been used for many years, the REFINE criteria is derived from the FINER criteria. The only addition in this criteria is actually the E, the equity part. So that's why we have reversed it, and now it's called the REFINE criteria for ease of memorizing and understanding this. Okay, so let's go to the first part, the relevance part of the research question. The relevance part answers these questions. How important is the question in terms of advancing scientific knowledge? So the question that we're asking should advance some level of scientific knowledge, or it should change or influence practice guidelines and health policy. So we are not talking about health research. That's why I'm focusing on health policy and things like that. But for any research, it should also influence or change practice guidelines and health policy. Or if this is more related to a clinical practice, then how important is this question to improve clinical care or a public health practice? How much does it really contribute to patient outcomes? Does it improve our understanding of disease pathogenesis, for example? If you go deeper into some pathological aspects of the disease, or does it also lead to some advancement in our understanding of developing questions for further research. So the relevance of the questions should be studied carefully before we really delve into further developing the research question. So in general, if you are writing a paper or if you have a grant, then would that really change something important? So this is a crucial question that has to be asked and that has to be in your mind before you further develop your research question. The second part is the ethics. Is it really ethical to conduct this study? I think this should be really straightforward because anything unethical should not be conducted. So there's no doubt about that. But the question that we have is, can the research question be answered through ethically sound design? So what does ethically sound design mean? So there are basic principles of ethics. So if we are talking about a treatment, for example, if there is a treatment option that has already been approved for use as part of a national guideline, and if someone is trying to do an experiment with that drug, withholding treatment for the other, for patients, just for the sake of doing an experiment, this is an outright violation of ethical standards. So we cannot withhold something beneficial to the patients or people involved. So this is just to give you a quick example about the ethical aspect. So it's very important before you proceed with your question to make sure that what you are proposing as a research question can be carried out through ethically sound design. The other aspect is feasibility. Perhaps this is the most common question that anyone would like to ask. And that's why in the final criteria you have this as a number one. So when you talk about feasibility, we are talking about availability of resources in terms of technical expertise, for example. Can you do this study with available technical expertise? If you are planning to conduct a clinical study, for example, and none of your team members have clinical qualifications, or yourself, if you are not able to carry out any of the clinical studies, then this is not feasible. If your study requires advanced laboratory techniques which are not available at your disposal, and then this also leads to some questions about the feasibility. The other obvious question is money. So you might have, an interesting question, highly relevant question, which can be carried out through ethically sound design, and yet you don't have the money that you need. It could be something very expensive. It can be a longitudinal study, a long-term study that should be carried out over many years using a very large sample size. So in such cases, you have to really have a good understanding of your financial resources. And the other question is time. When you talk about feasibility, it's about time. If the study that you're planning to conduct is a master thesis that has to be completed in 6 months, and yet your study takes up to 2 years to recruit the patients, the participants, then you have to really question this very seriously. So time is very important, especially for academic studies, something that is being done as fulfillment of your master thesis or your PhD. If that's something, a small capstone, you have to really have a clear vision about your time availability. And the scope of your study is also another important aspect. What kind of, scope are you covering in your study? So something that you are going to do should be within the scope that has been defined for your specific purpose. So feasibility is really, really important in order to conduct, to define your research question. Interest. So interest is an interesting aspect. But sometimes some people do some studies or pick a question just because this was proposed by a supervisor or by a mentor or by the department head, even if they don't like the question. So that's very important, and it affects your ultimate success with the studies that you'll be conducting. So the first question that you should ask is it really interesting to you, to yourself? Do you have the passion to do this kind of study? So that is absolutely essential. And then it should also be interesting to your colleagues, because when you do a study, you do this in a team. Even if you are just the main lead, and what is in the minds of your colleagues also affects. So if they like the idea and if they support your idea, if they think this is interesting, then most likely you will also receive support from them. But we should also be aware that sometimes there are some competitions in research groups. So we don't share ideas just with everybody. And anyone that listens to your question should also be a sympathetic colleague, somebody closer to you and who can really listen to your question and advise you. So that's very important. Sometimes people can just shut down your idea. They can discourage you from continuing to advance your idea. So it's very important whom you talk to. And your mentors. So that's also another aspect. They are very important. It should be interesting to your mentor. Otherwise, they will not guide you. Or even if it's not interesting to your mentor, then you should try to explain it more clearly. Sometimes the mentor can be very busy with other things and may not pay attention to it. So it's very important to take time to explain and make sure that this is really interesting. And finally, it should be also of interest to the target beneficiaries. So these days, we often work with the communities, representatives of the communities, patient representatives, for example. So you have to really discuss this. If that's possible, it's very important to have the interest of the target beneficiaries also factored in. Then the novelty is really crucial because, are you addressing a new issue or problem? Or is this the same question that has been studied 100 times in your department and you are still asking that question? So that's very important to know whether what you are asking is a new question or a new issue. So sometimes you find this kind of, master thesis or your PhD or studies that have already been conducted many times. So that comes from your knowledge, prior knowledge of the literature review or in your presentations, in your um, conference interactions, you find out that this has not been decided. The other aspect is your question should also contribute to discovering something new. It doesn't necessarily mean that you have to have always a groundbreaking research. It shouldn't be a new finding. It can be a small addition, but a small discovery. So that's very, very important to be aware of. You can also think of the novel method, or approach. It shouldn't necessarily be something new. The same old thing, but you are now using something new. The method can be a lab method, or it can be a statistical method, the way how you analyze it. So you have to really make sure that what you are proposing has some new aspect. The novelty is very important. And the other aspect when you talk about new things is about new guidelines, recommendations, or services. So you have to look at the potential of this research question to lead to development of new guidelines, recommendations, or services, and also new ways of improving impact of existing guidelines. So these are important, and whether your study can also change our understanding of disease pathogenesis and so forth. So overall, is your research question just a me-too question? Something that has been repeated over and over again, or is this something new, and is it really making some significant advancement in the understanding of a certain problem? Finally, we have to really look at the equity aspect of research. So this part was often ignored, and so the key question here is, does the research address a neglected but common disease problem in the area or in the country or in a region? So equity should be seen from different perspectives, including from geography, from populations, covered, different group of people, marginalized groups, and so on. So this is a crucial component. And if you look at most of the publications, they usually come from the same place in a country, just for the sake of convenience and just because facilities exist there. But when you think of a new good research question, you should always think of the equity, so that you don't neglect an important problem. So for example, the key affected populations are crucial in any disease. So this is particularly for me as a TB researcher or HIV researcher, these key affected populations are very important in the inclusion of any study question. So finally, so where does a research question come from? This is a very common question. Where do I start with a question? And there are many sources, but the first point of a research question to start with is doing some literature review. Looking at the previous research. Look at also on at your own past research. So that's very important. So staying up to date with the literature is important to generate a good research question. If you are an active researcher, then the research question is always a continuation of that something that you have already started. When you go to a conference, when you present your ideas, and then when others ask you questions, and when you listen to the presentations by others, you come up with great research questions. So staying up to date is a crucial component of generating a good research question. The other source is the general observation. During clinical practice, you have to be curious about some of new patterns that you see in your patients, during your community practice as well, during your casual encounters. So you should be a keen observant of what's happening around yourself, so that you can really ask good questions that can contribute to improving health outcomes at broader level. Sometimes disease outbreaks and pandemics also lead to generating research questions. And for this, I think the COVID-19 is a very good example. In some instances, some research priority documents, especially those written by governments, donors, academia, they also have a list of priority research questions. So if you have this kind of documents, and if you are responding to a document that has clearly indicated which area should be priority, then that should be your guiding document to start your question. So most experienced researchers or implementers, they start from this kind of documents. They respond to a question, often called a request for, funding applications, and you can start working to fulfill the criteria set out in the priority research documents. So these are some of my thoughts around how to develop a good research question. If you have any question, you can add your questions in the comment section, or if you have also any concerns or any comments, if you need more resources, you can just add your comments and I can email you, or I can also present more videos of this sort in the future. Thank you very much.